Welcome to Robert Wood Johnson University Hospital, Somerset's HealthTalk. I am Dr. Douglas Ashinsky of RWJBarnabas Health Medical Group. In accordance with social distancing due to the COVID-19 pandemic, I am hosting this show from the studio, and our guests will be joining us remotely via video conferencing. The COVID-19 pandemic has had a far-reaching impact on our economy, resulting in job losses and financial hardship that in turn affect access to health care. The LGBTQ community has been particularly hard hit during this time. During today's show, we are going to take a closer look at the barriers to healthcare for the LGBTQ community and how the Babs Siperstein PROUD Center at Robert Wood Johnson University Hospital, Somerset is addressing this with the help of a recent grant from TD Bank. We are joined today by Danielle King, the patient navigator for the Babs Siperstein PROUD Center at Robert Wood Johnson University Hospital, Somerset, and Akash Mahajan, Vice President and Regional Giving Manager in the Office of Charitable and Community Giving for the TD Charitable Foundation. Welcome to the show. Thank you both for being here. Thank you, Danielle. Thank you, Akash. Now, for the audience, can both of you give us a little background on yourself? Danielle, tell us where you're from and what got you to become a patient navigator at the Babs Siperstein PROUD Center.
Absolutely. Hello, my name is Danielle King. I work for the Babs Siperstein PROUD Center out of Robert Wood Johnson. We are the first hospital in the state of New Jersey to have a facility of this type. We service the LGBTQ community. And how I got here was, I'm actually a veteran. I was in the United States Marine Corps. And I was in during the Don't Ask, Don't Tell policy. During that time, I realized how policies can truly affect people and how it can change the whole breakdown of family and everything. So from there, I went to Rutgers, received my master's, and I knew that working in the healthcare field is exactly where I wanted to be. So I worked for Rutgers for a little bit doing health education. From there, I moved on to work for RWJ, and I absolutely love what we do. It's so important, the work that we do. We started off in a small little back room, just with a phone and a computer. We've have expanded our entire team up to about 10 now. We have our own facility. We have 3 exam rooms. And when I first got here, we had about 50 patients. We're now up to 1,000, which I'm very proud about.
Well, first, we're very proud of you, and we want to thank you for serving initially, as well as everything that you are doing for the Babs Siperstein PROUD Center, and we'll talk a little bit more about that. Akash, do you want to tell us a little bit about your background and just so the audience gets to know who you are?
Sure thing, and thank you for this opportunity this morning. So my name is Akash Mahajan. I am with TD Bank, America's most convenient bank, and I'm celebrating 4 years with the bank. But my career spans the nonprofit sector, the public sector, and now back in corporate, where I've always worked on different causes. So I worked in 3 different countries, now here in the US for the last 3 years, working with companies and supporting different causes, but I've always done that from the outside. This role at TD allows me, I am a part of the social impact team, under which we have the TD Charitable Foundation that I'm a member of. And that allows me to work with organizations such as RWJ on different causes. For the longest while, I led our Better Health Driver, which is where this conversation started. And recently, I have moved into a new role where I am going to be leading the charitable giving in our Metro New York market.
Thank you very much, and thank you also to TD Bank for being charitable for good organizations. So let's first talk to Danielle. First, can you explain to the audience what a patient navigator is?
So a patient navigator, what we do is we help underserved populations. We have Chinese navigator, we have Hispanic navigator, I'm the LGBT navigator. We help these underserved populations move through the healthcare system. So a big part of what I do, which is a little bit different from what the other navigators do, is I call different facilities, whether it's orthopedic, cardiology, whatever it may be, and I try to find out, is your office LGBT friendly? Do you understand transgender? Do you understand pronouns and preferred name? And that's very important because we want wraparound care. We want to make sure that we keep people within the healthcare system. And if they come to us and I send them somewhere else, I want to make sure that they're treated exactly the same. So that is a big part of what I do. What I also do is help people with housing, help people when they have domestic violence situations. There really is no limit to what a navigator can do.
So you are the go-to person for the LGBT community as part of the Babs Siperstein PROUD Center at Robert Johnson University Hospital.
Absolutely. And even if somebody's not a patient of RWJBH, I still help them. So it doesn't matter if you live in New York, if you live in Philly, if you have an issue and you can't find somebody to help you, I've definitely helped out. I don't mind.
For the LGBTQ community, can you tell us the barriers and what the patients are actually facing in order to access healthcare, how it's so hard for them to access the current excellent healthcare that we have?
There's several barriers. The biggest one that I'm seeing right now is unemployment. People who are not unemployed have harder issues getting on health insurance. And yes, they may have state insurance, but state insurance is not always the best when you're comparing it to private insurance. Also, transportation is a big one. And also, when you actually get to a facility, being able to pay for things like co-pays or pay for things like mental health, which is what the grant helps cover. Another barrier that we do see is just lack of support. So at Babs Siperstein PROUD Center, we do try to act like another arm of a family for our patients, give them that type of support to help them get through their life.
And what else has the COVID pandemic, how else has it affected the LGBT community? How has it affected their health?
Oh, absolutely. We've seen a lot of our patients have ended up in the ER from different things, especially from COVID. And those ER bills can be extremely costly. And the other thing that we had seen during COVID was a lot of our patients were getting kicked out of their houses very early in the pandemic. When this thing hit in March, I would say by June, a good portion of our patients were already homeless, or they already had lost their jobs because their jobs, for a lot of them, they were the first to go, which is completely unfortunate. But this is the reality that a lot of people in the LGBTQ community deal with.
And the LGBT community of color, how are they affected?
The LGBTQ community of color is that intersectionality of having those multiple issues, those multiple barriers that come. And honestly, when I'm talking about unemployment and I'm saying those patients were the first to go, those are the ones that I'm actually talking about. So how can you even process, oh, I have to get to the doctor, oh, I need to take my medication, when you don't even have a safe space to hold those things? Or when you're looking for transportation to get to a doctor and you don't have access to a car or have access to even money to be able to get on a public bus or public transportation. So for specifically the trans community, it has been extremely detrimental to the community as a whole. Yeah.
So the Babs Siperstein PROUD Center really is a home away from home for some of these patients.
Absolutely. And that's what we strive to create. When we have our patients graduate from injection training, we clap them out. We give them a certification. When they need help with food, we do have food gift cards. We give them $100 gift cards for food for ShopRite. If they have transportation issues, we have gas cards to help them with that. We also pay for Uber Health for our patients when they need that as well. We also have mental health. So we really try to do the whole thing.
And mental health, tell us a little bit about that.
With our community, when you're talking about people who've been underserved for such a long time, that brings on a lot of trauma. There's a lot of things that people hold on to, especially when you don't have support from family, or you go through things with your family members that a lot of other people in a sense don't have to. That creates a lot of trauma, PTSD. Then when you're talking about having to live in a shelter and what happens to people when they live in shelter, when you're constantly in survival mode, that creates a different type of mindset. It creates a different mental state. So we do recognize that with our patients, which is why our first appointment is an hour long, because we give our patients the time to talk, the time to vent, the time to really have somebody speak, have somebody listen to you. It's very important. So for us to have mental health, to have a therapist on staff is extremely valuable and important for the wraparound care for our patients.
And again, that's what's so important, is that the Babs Siperstein PROUD Center has, as you describe it, wraparound care. It's not just a single person that they're seeing. They're seeing the whole gambit of all of healthcare and getting access to it.
Absolutely. Absolutely.
And the other thing is that because of, up until the pandemic, we would have talked probably about the transgender patients as well, and diseases such as HIV. But because of the COVID-19, HIV sort of got pushed to the background. However, it shouldn't be pushed to the background. Can you tell us a little bit about how important HIV prevention, treatment, health risk is for the LGBTQ community?
Absolutely. So we work with different community partners. We work with Zufall in Somerset. We also do work with Hyacinth AIDS Foundation, who is located all throughout the state. And we try to make sure that our patients are, number one, tested, that they are treated, and that we're making sure that other parts of their lives, like housing, is covered, especially for our HIV patients. People think right now, oh, COVID is the biggest thing, but HIV is still lingering. We do have access to PrEP, pre-exposure prophylactics, which is something that we do offer in our office to prevent HIV. But it only prevents HIV, but it doesn't prevent other things. So we're also seeing an increase in other STDs because patients are thinking that PrEP that HIV is the end all be all, but the other things are not the big issue. So we have seen an increase in syphilis and chlamydia and gonorrhea. But to go back to HIV, it is so important. It's so important. In our office, we have Dr. Samuel Abdullah, who is our medical director, who is also an infectious disease doctor. So if anyone is having risky sex or unprotected sex, they can definitely come see us, get tested, and we do also treat.
Terrific. It's so terrific to hear what you're doing and what the Babs Siperstein PROUD Center is doing to help the healthcare of the community.
Thank you. I appreciate that. It's very important to us. Our office takes this very serious. Most of us are in the community ourselves. So we look at this as like trying to basically help out our family and our friends. And we come to work every day with that type of passion.
And it's so wonderful that RWJBarnabas Somerset Medical Center has done what they've done and have improved, increased the size of the Babs Siperstein PROUD Center, and basically brought out something that there's no other place like it in all of Jersey.
Oh, absolutely. And I've been asked by our competitors, hey, come over here. We can offer you more of this, more of that. But in all honesty, I don't leave because of the leadership here at RWJ. I strongly believe in our team for the simple fact of that we saw an issue and they were willing to move forward in creating something like PROUD was very important to me. Not only that, but our benefits for our staff that work here. Honestly, you don't see any better anywhere in the state. So I'm very proud of our team. Absolutely.
And not only are we proud of you, but TD Bank was so proud of you that they awarded a grant to you. Akash, do you want to tell us all about this grant, why it was given, what it can be used for, and just how important TD Bank thinks of the Babs Siperstein PROUD Center?
Absolutely. So let me just start by saying that first and foremost, we at TD believe strongly giving back to our communities that we serve. But it's also important to understand that our commitment is, to veterans, to Black and brown communities, and the LGBTQ2+ community, it spans more than just an individual grant, a day or a month. We're really trying to make meaningful investments. And in that, we are understanding the unique challenges that those communities face. And we have to acknowledge the contributions that these communities have made. And that's why we have to look for partners where our value aligns. So at TD, we've got our corporate citizenship platform called the TD Ready Commitment, under which we have 4 areas which we call drivers of change. One of them is health. And Danielle's spoken about this much more articulately than I have, which is the challenges that the community, the LGBTQ2+ community is facing. And when we do a deeper dive looking at the trans community, Danielle's spoken about the multiple barriers to accessing care. Our vision through the Better Health Driver is striving for equitable healthcare, and we're really focusing on access to care. So when we heard about the program that the Somerset Clinic is running, the way they want to tackle the situation, the innovation within the program itself, the relationships that they're building, and again, not just tackling one piece, but the holistic support that they want to provide in treating the individual with respect, keeping in mind the cultural nuances, the historical nuances, and the barriers that they face. We thought this was the right program for us to support.
And again, we have to congratulate TD Bank for their support of this terrific program that RWJBarnabas Somerset Medical Center has, and the grant and anything further that TD Bank chooses to help us with.
Absolutely, I agree with that. Primary care is not a moneymaker, and to do what we do, it does take help from outside entities. So we're very thankful to TD Bank for stepping in and helping us in those areas where it's definitely needed, being able to pay for patients who don't have insurance, being able to help patients who have HIV who are on PrEP by helping them with a PrEP counselor, being able to help support our patients with therapists due to this grant. It's so valuable and important, especially for the community that we're serving. And we hope to honestly continue our relationship with TD Bank, and we're very, very grateful. I can't express it enough. Very thankful. Thank you.
Now, tell us a little bit more about the Babs Siperstein PROUD Center. A lot of people don't know very little about it. So if you are someone of the LGBTQ plus community, how would they get in touch? How would they establish themselves? What do you have to offer? Tell us a little bit about it, so that someone who, and it's so hard out there right now, especially with the COVID pandemic, with offices not being open, with telehealth care. How can someone get themselves into the Babs Siperstein PROUD Center?
Yes, so literally just give us a call. We also, on our website, if you want to Google us, there's a way that you can contact the office. From there, we send intake forms for our patients. Once we get that back, we give you a call. We schedule an appointment. You'll have 3 appointments if it's HRT. You'll have 3 prior appointments. You'll meet with our doctor. Our first appointment is an hour long. And like I said before, that's because a lot of other providers don't do that. And a lot of other providers don't take the time to do that. But we make sure that our providers are not sitting in front of the computer, and that they're staring at you face to face and having an open conversation. From that point, you will have follow-up appointments. Our follow-up appointments are about 30 minutes. And the things that we do at our office are hormone replacement therapy, which is probably about 80% of our patients. We do PrEP and PEP, which is about, I want to say, 10% of our patients. And then within those, almost all of them come to us for primary care. So we do primary care. We also have an OBGYN on staff. So we do, the PAPs, the regular checkups. We also do hysterectomies for our patients who are looking to go that route. Or even if our patients just are having issues, we also do that as well. We have HIV prevention and treatment. We also offer therapy for our patients. And then for me, from your first appointment, I either meet with you in the office while you're here. I'll sit down with you, get an understanding of what are your challenges to figure out a plan for you moving forward. Or if you didn't meet within the office and you did a telehealth visit, then I would give you a call and have a meeting with you that way. What is so great about our office is, if you are not required to come into the office, you can have telehealth appointments. So if you have barriers, if you're handicapped, if you have issues coming out, or maybe because you do have a full-time job, but you don't have time off, we also respect that as well. And we try to work around people's schedules. So we do have telehealth options available for people as well.
Again, what you are is you are the full care to the LGBTQ plus community.
Yes.
You take care of their severe problems, but more important, you take care as a primary site also. Many primary sites are not set up to help out the LGBTQ plus community, but you are, and you see the people, you take care of the people, you take care of the acute problems, the chronic problems. But in addition, you go through the socioeconomics of their situations, how to help them, how to improve them, how to get them there. And you take the time, which again, most people will tell you when they go somewhere, they don't get the time that they're getting over by the Babs Siperstein PROUD Center.
Yes. And that time is very important to us. Once we started here, it was originally 15 minutes. And quickly, our provider and our whole team was like, this is just not going to work. These people need time. They need time to talk. The LGBTQ community notoriously goes to urgent care when it's too late, or they go to the ER when it's too late. But here at Babs Siperstein PROUD Center, we want to make sure that we're catching you before anything is a problem, so that if you do have a problem, it's treatable. We don't want to get to the point of where it's a stage 4, it's terminal cancer. We want to catch things in the beginning. If you have diabetes, we want to catch that early. If you're having kidney failure and stuff like that, these are things that all need to be caught earlier on in order to help treat and have a healthier outcome. So I'm very proud of our providers stepping in and saying this is what we need to do and taking the time with the patients, because it's very necessary. Some of these people have not seen providers in a long time.
And you also provide the continuity of care, which is so important. The fact is if they go from urgent care to urgent care to urgent care, they may get the simple thing taken care of, but no one's looking long-term. Why is this happening so much? You can think about why it's happening, whether it's a medical issue, whether it's a socioeconomic issue, and you can give them that continuity of care.
Absolutely. And the thing is that when we have patients, and let's say you need to go to the ER, we send them to the ER here so that your medical record, anything that's happening, stays with us. Our doctors follow up. But we always try to make sure that we're keeping everything in-house within RWJ system. It's a lot easier for us to backtrack and look at your progress through our systems that way.
And in addition, since we all are going to the EPIC system, it allows everyone's results to be all-inclusive. So when they do come to you, if they have been somewhere else, you have that. You don't necessarily have to repeat what's previously been done.
Yes, EPIC has been really great in that way, that we can find different things through the patient's charts, whether they went down south, whether they went somewhere up north, wherever it is, we can find and track down those records and be able to have a really good view of what their health has been.
And let's get back to Akash again. Again, thank you for what you're doing for TD Bank. Do you want to tell us a little bit more about the grant, what RWJBarnabas Somerset Medical Center can use the grant for, and what else TD Bank wants to help to partner up with, and why we should support them as a community bank in this area?
Yeah, those are great questions. I'll start with one again, the need. Danielle's spoken about the need. We see lack of so many factors that are impeding access to care. So first and foremost, we want to ensure that LGBTQ2+ members have that access to care. So when they walk into Danielle's office, they feel confident. They are not worried that there's going to be stigma, they're going to be misjudged. Somebody will not understand who they are, their background. So that comfort zone, creating that comfort zone is first and foremost. Secondly, then addressing what are their diseases and conditions. And as Danielle said, so much of that is preventative. And that's really what our focus is on that preventative access to care piece. So whether it's towards a chronic disease or a condition or mental health supports, it's all tied together. We want to ensure that somebody gets that continuum of care and doesn't fall through the cracks. And that's what we saw in the program. And that's what we continue to do. We want to see, we don't want to talk about, for us, what's important is we don't want to talk about just the input. It's the outcome. What are we collectively trying to achieve here? What's the problem that the community is suffering from or facing? What's the solution? And how do we make their lives? And we're really trying to understand that in three ways in terms of lives touched, lives changed, and life enhanced. And that, again, is what aligned us and the work that the Somerset Health Clinic is doing. That's where we found alignment, and we thought this is a great investment for us to make because we are going to see these real impacts in the community.
And what is TD Ready Commits?
So the TD Ready Commitment is our corporate citizenship platform. It allows us to strive towards our vision, which is creating an inclusive future for everyone. And we're doing that through 4 interconnected drivers of change: financial security, better health, vibrant planet, and connected communities. Because we believe that if you do not move the market in all these 4 issues, you do not have people or communities feel included. So as such, TD is targeting $775 million in community investment across these 4 areas by 2030, which we feel will help people feel confident, not just about their finances, but about the future, and at the end, helps open doors to a more inclusive and sustainable tomorrow.
Very nice. It's a terrific philosophy and a terrific commitment by TD Bank to help in what they're doing. Danielle, do you want to tell us anything else about the Proud Center team? Anything else about the Babs Center before we conclude?
Sure. I would love to take a moment to talk about our team. I've worked in many different fields. I've worked in different healthcare fields. And honestly, I just want to take a second to say thank you to the team here, because without our team, none of this would be necessary. Our nurse, Jamila Carter, our patients, some of our patients are like, if she leaves, I'm out, because they love her so much. She makes sure to take the time. She calls our patients. She makes sure that they're doing okay on their medication. Same thing with our MA, Esther. Between the both of them, I can't say thank you enough. And our front desk, they are the face. When patients first come in, they are the first ones that they greet the patient. And that, from that point on, kind of, it shows it's going to be, how do I say it? From that point, that kind of sets the tone for what is going to happen for the rest of their entire visit. Because if you come through the door and you're greeted by somebody who's not joyful and not happy, or somebody who misgenders you or uses the wrong name, that can set the tone in the wrong direction. So thank you to our front desk, Avery Hyman and Jen. And then also, last but not least, Amina, who is our practice manager, who does everything. She will room patients, she's calling patients, she's in the back working on insurance, she's the whole everything. Literally, our whole entire staff, we love what we do. We love taking care of our patients. And that is why our team at Proud is so different from other places. We literally had to handpick individual people. Some of these positions took months to fill, because it was that important to us to know exactly who was going to be in that position. So if you come to us, just know that you will be treated like family and like friends.
Thank you, Danielle, for everything that you do as the navigator at the Babs Siperstein PROUD Center. Thank you for your commitment to better care. Thank you for what you do. Also, Akash, thank you so much for what you do, what TD Bank does. We're very proud to have you as a partner in our journey in healthcare. Thank you both for being at the show.
Thank you. Thank you both.
Such a pleasure. Thank you.
That concludes today's episode of Health Talk. Please remember that the opinions expressed here today by our guests are not a substitute for medical advice from your own physician. If you need a physician, please call 888-724-7123. For more information about the Babs Siperstein PROUD Center at Robert Wood Johnson University Hospital, Somerset, please visit www.rwjbh.org/Somerset Proud.